Hello and welcome to the Blue Goat Cyber monthly webinar. Today we're going to be talking about cybersecure medical devices in healthcare delivery, what we need to do to make sure that we're sharing responsibility. We have security addressed at the manufacturer level, security addressed at the healthcare delivery organization level, and we have a clear understanding of the roles and responsibilities that everyone plays in this process. I'm Trevor Slattery, the COO at Blue Goat Cyber, and I'm joined here by Parker Daudt, one of our senior penetration testers. How are you doing today, Parker?
Good. How are you doing, Trevor?
Not too bad. The fog's rolling in here in San Francisco, and you're up towards Portland. Is that right?
Yeah. So we're looking, hopefully not too much rain today, but it's pretty cloudy, pretty chilly. But
I feel like that's about par for the course for Portland. It's rainy and chilly.
Yeah.
All right. Well, we can go ahead and jump right in. So one thing that is really important to consider here is how connected healthcare is becoming. It's something that I don't know if people understand the full scale of it, but of course, as we're moving into a more and more digital age, we're seeing more and more of this make its way down into medicine. It's estimated through surveys with hospitals that around 51 to 70% of medical devices are connected in one way or another. This can be through many different functionalities, though some of the more popular options at this time: remote patient monitoring, cloud data platforms, remote treatment, connected Internet of Medical Things networks, and of course, we're seeing the rise of telemedicine and artificial intelligence within the healthcare space. I know at Blue Goat Cyber, we see a very wide range of different technologies here. And so it's great to see how we're pushing healthcare forward. But of course, there can be some risk that we're getting exposed to when we have these more connected systems. This is where we're going to want to talk about shared responsibility, what manufacturers need to do, and what the healthcare delivery organizations are going to need to do to stay defensible, to stay safe, and to stay secure during deployment. All right, so when we're talking about this connectivity, this is where we're going to dive into how that connectivity can lead to risk. Around 53% of medical devices are estimated to have known critical unpatched vulnerabilities. This means that there is a flaw in the device that can either lead to potential harm for a patient, a massive disclosure of data, or a significantly reduced functionality in the product that is going to impact the healthcare delivery organization. These vulnerabilities can lead to significant consequences. I know we've already mentioned patient harm, data access, though this isn't where the damage can stop. When we're in a connected environment, we're expecting that there are going to be other products in this connected environment. We can see medical devices acting as a starting point for ransomware attacks, being used for lateral movement throughout the network. And then, of course, seeing that we have the supply chain compromise if we're able to compromise one of these medical devices, or even part of the medical devices. You know, often, Parker, we talk about entry points, and we're talking about what we can see, what we can access, what we can test. This is part of what the FDA's criteria is going to be for it as well. And so some of the early things that we can do, I know there's threat modeling, there's going to be, of course, the architecture review of the product are helpful. I'd be curious to hear your thoughts on what some of these early steps are that we can take that at least address where we're seeing that connectivity and identifying these points of concern.
Yeah, no, I think it's really important because I think when a lot of people kind of look at like attacking a healthcare, like a hospital or like a facility, they're thinking of the end result that, patient records, ransomwaring for just infrastructure control. And they don't really think of that initial entry point. So the devices that are sitting in a patient's room or sitting in a lab, you get people in and out of hospitals every day. So when we get a device, or when I get a device and I'm looking at it, I'll look at things like USB ports, Ethernet ports, really how someone walking by a device could easily or quickly, implant something malicious or try to pivot into another device from that item in a hospital room into the larger network. And so, yeah, you're right. We look at threat modeling and really just getting an idea of what is exposed or what could be manipulated.
I love that you mentioned this lens people come into this with starting with the outcome without thinking so much is how does this happen? How are these entry points considered getting in here? And it's a very important exercise to look at the outcome as well. We need to look at both sides of the kill chain, as the cybersecurity term goes. But starting with the outcome in mind and then moving back to how do we get to this outcome is a very popular exercise and is often going to be one of the more effective ways to understand some of these risks. Inversely, we're also going to need to understand what's the core attack surface of the product. What are the things we can interact with? What are the different interfaces that are going to expose us to a little bit of risk? So it's great that we have both lenses covered here. One major issue that we can see is when we're seeing these connected networks, the adoption and getting these devices into a connected network within a hospital can be a little bit difficult for medical device manufacturers and for the healthcare delivery organizations. Part of regulatory authorities' recent pushes for more strict cybersecurity guidance, more strict cybersecurity controls and labeling is a big push for transparency. We're looking for things such as a clear understanding of the device's risk profile, accurate instructions for usage of the device. Very, very importantly is having a clear manifest of everything that is built into the product or a software bill of materials. But the understanding of who is responsible for what part, how are we making this seamless and harmonized to integrate into a healthcare delivery organization can be a little bit difficult. I know, especially with SBOMs or software bill of materials, this is a common problem that we're going to see with a lot of our manufacturers as one of the more significant things that the FDA comes back with concerns. There's a lot that can go wrong with an SBOM, and making sure that we have this tailored correctly and we're performing a proper safety and security assessment against it is vital. Oftentimes when we're going through a cybersecurity assessment, we're preparing our quality documentation or performing testing on the device, I do want to caution manufacturers that you should expect to see a lot more vulnerabilities in your SBOM than you might even get from penetration testing or from other forms of testing. And part of this is just due to the fact that you'll have quite a few components in SBOMs. You can very quickly see hundreds of components or hundreds of libraries making their way into the system. But a lot of these SBOM components are just not going to receive the security support that is needed to make sure that they are going to be safe and effective within a medical device. So we want to be sure that we have clear responsibility, clear documentation. And one thing I'd be curious to hear your thoughts about, Parker, is when we're performing these assessments against an SBOM, comparing it to what you're seeing day to day with penetration testing, how much more significant do you think the lift is in one side or another for A, identifying the risk, but B, remediating it?
Yeah, no, absolutely. So yeah, with looking at SBOMs and comparing it to penetration testing, I do feel I've seen, noticeably more vulnerabilities or at least security concerns coming from an SBOM than you will with a penetration test. Manufacturers and people building and implementing through R&D have a lot more control when it comes to the physical interfaces, the physical components of a device, which you typically will be tackling through a penetration test. And then SBOMs are kind of those more behind the scenes, the software components that can easily start to balloon as you build more and more functionality, or the scope of your project and your device just becomes larger through that R&D process. So it's easy to have like one line that imports a library from a third party, and you maybe aren't considering what issues that may be bringing, especially from like an upstream consideration. So it's easy to start just introducing things through just easy one-lines or copy pastes from existing code repositories that have knockdown considerations later on.
100%. And the healthcare delivery organizations need to be aware of this risk and need to properly vet the devices that they're bringing in to make sure they aren't exposing themselves to unnecessary risk. Now, when we're looking at this, there are a couple of different challenges that we're going to see. We're going to see some on the manufacturer side, and we're going to see some on the delivery side. When we're talking about the shared responsibility model, it's still a little bit of a murky area at this point, understanding exactly where one line of fault starts and the other is going to end. As a manufacturer, we are going to want to see that you are adhering, of course, to the regulatory requirements outlined by the FDA, by the EU MDR, by the relevant regulatory authority in the market that you're accessing, and that you are using their guidance to build security into your product. These regulatory authorities are doing a pretty good job of trying to keep ahead of cybersecurity risk within medical devices. And as frustrating as compliance with the regulations can be, they are in place to make sure that we are releasing quality products. A big part of this, of course, is making sure that we are building the device with security in mind, as opposed to trying to treat security as a one-time study, which is often one of the biggest misconceptions that we see. This will be through things such as our supplier auditing, again, tying it back to the SBOM. What components are we really bringing into this device? Having a secure development framework in place. And this is where I'd like to talk a little bit more about another type of risk that we're identifying, which is within just purely how the code is written for the device. And so that would be through SAST, or static application security testing. And one thing that would be helpful to understand, Parker, is where are we seeing the differences between SAST and then, of course, testing against the SBOM, since it's both against the source code, correct?
Yeah, so you get both. SBOM's looking purely at what packages or what references are being made to third-party components or external things that are being brought into your product. SAST, on the other hand, is looking at how the code base of the entire project works, how the functionalities that control the operation of the device, how that is being coded line by line. So rather than just looking at more of a one-time import of a library or reference to something external, SAST looks at the full functionality of the device in the context of how it works and how it's used in a healthcare setting.
So would it be accurate to say that the SAST, the static application security testing, is going to be against the code that you control, and the SBOM would be against the code that you maybe don't control?
Yeah, absolutely.
Now, when we're talking about what can be some significant considerations, what can be some risks, we also are going to want to talk about what good looks like. When we're going through this process as a manufacturer to consider these early cybersecurity efforts and make sure that we are building a safer and effective product, what are we actually doing? When we're looking at this, and when we're looking at any of the major regulatory authority guidances, they all are going to say that cybersecurity should be addressed throughout the total product lifecycle. Total product lifecycle is a critical term here. When we're saying the total product lifecycle, we often say design to disposal. So the second we start building this product, the second we start sourcing the requirements, what does it need to do? We should think about how does it need to do it, and how does it need to do it securely, moving all the way down the line to what's your plan if you choose to no longer support this product? Are you just going to leave them out on the market? Are you trying to collect them back and dispose of them? Is there any protected information that could potentially be left on them? There are a lot of things that we need to consider, and these regulatory authorities do not want to see us missing any step of this. This is going to be the same with healthcare delivery organizations. They'll often have similar, if not in many cases, even more strict requirements than some regulatory authorities. When we're covering the cybersecurity throughout the total product lifecycle, this is through some early assessments and early understanding of what are the potential risks in the system. We talked a little bit ago about some potential threat modeling, understanding what are the entry points and how can we potentially be exposed to risk through them. We've talked about some secure development activities to make sure that we're designing the code safely, understanding our third-party components. And then this is where we're going to talk a little bit more about the security risk management process as a whole. So when we're looking at this, all of these steps, the secure development, the testing, the threat modeling, your risk assessment is all part of security risk management. It's a sequential process. It's something that we are going to conflict or deconflict against safety risk management to get an accurate understanding of what risks are present in the system and exactly what the scope of them will be. Part of this process is going to additionally be through our penetration testing. And penetration testing is something that is especially vital. Within medical devices, it's a little bit different from traditional penetration testing. The ultimate goal is going to be the same. So we're trying to have an understanding of what risks may be present in a system through emulating a hacker through manual efforts. So we're trying to pretend to be the bad guys for a little bit to see what could go wrong. When we're looking at medical devices and we're going through a penetration test and we're going through any risk assessment, I know it's very important that we're factoring in a few different considerations that might be unique. For an example, we likely wouldn't have patient harm if we were dealing with penetration testing for financial information. So Parker, what do you see as some of the different ways that we can accurately assess risk within a medical context for this risk management flow?
Yeah, no, I'm really glad you brought up the difference because that's something, especially having worked previously in a more traditional penetration testing role, you kind of have to readjust or reframe what risk and what impact looks like when you're dealing with medical devices. So, a financial institution, you may be more interested in, if can someone pull money out of an account or can someone transfer funds between two unrelated or unrelated accounts. So, but in medical, you're looking at the end patient. What kind of harm can I do as an attacker to someone sitting in an emergency room or an operating theater? What physical harm can you do to somebody who's using your product? And so that's the biggest kind of reframe. So you start looking at, can I discharge electricity from this device? Can I overload any sort of like transistor component to physically harm a patient? Can I take their sensitive medical information? Can I disrupt operation that maybe renders this device inoperable at a critical or crucial junction when a doctor may need it in a life or death situation?
I love what you said about the disrupting operations. Even in the full scope of the hospital, it can be pretty severe. Like if we have a vulnerability that hits one device, it can spread all throughout the hospital network. Isn't that correct?
Yeah, absolutely. And that's the biggest thing. Is also considering each device as an entry point that could be used to disrupt entire network connectivity or network communication from a single device in a room could have knock-on effects that affect all connected devices. If nothing is able to connect or communicate over a hospital network, you may shut down health monitors or may shut down other equipment that's critically in use at the moment.
It's interesting that we're talking about these different entry points, and it seems that there are two lenses that are going to come up. We're seeing what an entry point would be for a device manufacturer. They're looking at their device. They're thinking about, you were talking about earlier, USB and Ethernet port. That's the entry point into their system. But the hospital would technically consider the full hospital their system. So the device itself could also act as an entry point. So it's interesting how you have these different layers of, I guess, abstraction from one level to the next when we're looking at these larger systems.
Yeah, absolutely. Yeah, I think when you start looking at the security through the different lenses, whether you're the manufacturer, you're more concentrating on your physical device, but if you're the hospital CEO or CTO or CISO, you're looking at your entire kind of attack surface of your entire hospital. And that's literally anything that maybe is a visitor bringing in a smartphone to connect onto the guest or public network, or the physical device that you're bringing in from a new manufacturer.
100%. So when we're looking at what some problems can be, I guess if we're looking at what good looks like, we'd also want to understand what it would look like when we're getting a little bit away from good. There are going to be too many different types of risks to list in a single webinar, to even list in a series of webinars about what vulnerabilities can come up in medical devices. And partially this is due to the unique nature of medical devices. There will be novel, unique vulnerabilities that we are discovering every single day at Blue Ghost Cyber due to the fact that so many of these technologies are being used for the first time. When we're looking at what we see as some of the common problems, though, I like to think about what are the big risk problems that really don't take that much effort to address. So hard-coded credentials. I say this cautiously, as I know any penetration tester will know better than to say, oh, how hard can it be to fix to an engineer? And so for any of the engineers out there, I do understand there can be a little bit of some complexity there. But when we're looking at things like hard-coded credentials, the identification of them is a very, very easy process. If we're designing them out of the system early on, it's not even something that should come up. It's rarely going to be a constraint on hardware unless we are using very low functionality or very low power usage devices. Then we're going to see a little bit more of a constraint there into play. But going down and understanding what risks are present is going to be really important for this. It allows manufacturers to cross off some of these early items off. Unencrypted communications. This is something that the FDA is really concerned about. They don't want to see any sensitive information passed over plain text. Similarly, I don't think that any of us would want our sensitive information to be passed in the clear on a network with possibly thousands of people on it. We can go back into looking at any unique individual risk in the system, and it all comes back to designing the device securely the first go around, as opposed to trying to bolt on security towards the end. So when we're talking about any of these potential threats in the system, these are things that we should be identifying before we're actually designing it into the device. That's where we're going back. We keep tying this back to the early threat modeling process. Now, there are always going to be a few things that are out of our control, things that are happening within the supply chain, and then of course what our users are doing to the device. And so what can we do to try to control this a little bit? When we're looking at the supply chain, this is an easy way to tie it back to the SBOM. So that SBOM is going to have that index of any of the components in the system. And if you're building your SBOM correctly, you shouldn't be integrating system or components that may potentially expose you to quite a lot of risk. You should be talking to these suppliers early on, having a clear understanding of how long it's going to be supported, to what extent, when are they going to not receive security patches. When we're moving this down to the user level, this is where I think things become a little bit more complicated, talking about what information is communicated to end users to make sure that they are using a device safely and effectively. This is a form of risk transfer. So if there is some level of risk remaining in the system and it's going to be too hard to design out, we need to look for a way to try to transfer away some of that risk. We need to make sure that the user, the operator, or in a worst case scenario, the patient, is very well informed of what potential risk they may expose themselves to and what best practices they can take to mitigate that risk. Now, one thing that I do like to lean into a little bit here is governance. Governance is where we can have control on a device, on a process, and this is where I think the line's a little bit blurry between the manufacturer and between the healthcare delivery organization. So we want to see that it is clearly defined who owns and who is responsible for what process, similarly to how device manufacturers need to properly vet any components they're using in the system. Hospitals need to do the same for the device as a whole. They need to follow similar risk management frameworks. They need to follow similar post-deployment monitoring to be sure that the device is secure, even once it has been fielded. Now, I know this is a little bit of a loaded and a broad question, since there's so much that can happen within a hospital and everything is going to be unique in the hospital environment, similarly to the devices. But I'd be curious to hear your thoughts on what are some just easy wins. I know we were talking about some of the easy wins for manufacturers, but what would some easy wins be in a hospital network that a healthcare delivery organization can take today?
Yeah, so I think some really good, easy wins that a hospital healthcare delivery organization can implement really starts with, network segmentation. So splitting off key infrastructure networks from maybe your tradition or your implemented like guest network. You don't want someone's just phone hopping on and being able to, pivot into billing or any of the like sensitive key areas of your network at a hospital. You can also implement strict kind of bring your own device policies that a lot of other companies just in general are implementing to make sure that the devices that are connecting meet a baseline standard of security. You can also look at implementing some like system monitoring software to make sure traffic going across your network is kind of typical or being secured in that way as well. So those are some really just easy wins that maybe as a hospital you're not necessarily considering, but you can kind of take some playbooks from other organizations across different industries as well.
Do you think that threat modeling can be an effective tool for hospital networks as they're designing that architecture similarly to how it's effective for device manufacturers?
Yeah, absolutely. I think it's important that you can implement threat modeling really anywhere, whether you are developing a physical device, a software that's getting deployed online, or building out a network. If you can have that insight into kind of attack vectors where information is coming in and out, how information is being transmitted across your network, having that really overview of what a threat could look like and how you might be able to mitigate that through your modeling as you're implementing things or building them out, or even just upgrading existing infrastructure can really provide that valuable insight too.
I think if we were to take a takeaway from the middle of this webinar here, it would be perform threat modeling. Regardless of what your product system is, perform threat modeling. It's an easy, low stakes way to find vulnerabilities before you're really exposing yourself to too much risk.
Yeah, absolutely. And it's important to realize that when you're threat modeling, things do change over time. Your network 10 months ago may look completely differently than what it does today. So maybe try to implement more periodic modeling just to make sure you're getting a good, accurate picture into what your infrastructure, what your network looks like.
100%. All right. Now, when we're looking at the total product lifecycle ownership, this is where we're hearing differing opinions every day as we're trying to understand a little bit more of a harmonized responsibility or harmonized ownership framework. And so, one thing that is important to think about is, where does this risk handoff really happen? Does it ever fully happen? Or is it something that is, always going to be a little bit of a shared responsibility? And we hear some conflicting answers to this. In general, once we're deploying a device, this is when the design and development is going to be frozen, at least to some extent. At this point, the device should be cleared by regulatory authorities. So they have given it the stamp saying, we've decided that this is going to be safe and effective for use. And what is the manufacturer going to still be responsible for? They're likely going to be responsible for patching the device. They're likely going to be responsible for helping the healthcare delivery organization with deployment, installation, configuration, some of these early things that can help the healthcare delivery organization use the device a little bit more effectively as time goes on. But once we have a risk that gets introduced to the device, when it's out on the field, this is where the question comes in. Who is responsible at that point? Is it the regulatory authority for not clearing the device well enough? Is it the healthcare delivery organization for not securing the network around the device? Or is it the manufacturer for not building the controls through sufficiently? So there is a lot that can kind of be factored in here. And then I did see that we had a comment come in here. I'll bring this up here. So after 17 years with a medical device manufacturer, the challenges that you saw were around the regulatory restrictions of allowing the customer or user to perform pen testing on the system. Most of these instruments should be treated as an OT platform, while the connectivity software can be treated as a more traditional IT system. Differentiating those two, although they're invariably linked, is a huge challenge. I 100% agree here. So when we are trying to draw the line, and I guess backing up even and talking about who is allowed to pen test products, this is something that comes up for us quite often as well. When we are working with a manufacturer and they'll have certain components that they're integrating in, they need it tested as part of that end-to-end perimeter of their device, but there are going to be restrictions. Of course, us as the penetration testers, we need to make sure that we're in a green area to go ahead with this full process. And so going through some of the loopholes past even the regulation, past what the suppliers themselves are comfortable with, can be difficult to make sure that we're fully addressing cybersecurity. And so drawing these lines, I think, as you're saying, it can be very important to have this clear separation between connectivity and then, of course, just the more like hardware-focused solutions. But having that line on when we can start the testing, what we can fully test, I completely agree. There's definitely some nuance there. All right. Jumping right back in here where we're going over some of these total product lifecycle ownership activities. One thing I do like to outline is the penetration testing within the system. So we've performed a lot of testing against devices, obviously, and then a lot of testing against a network containing devices, such as a hospital. And so, Parker, when we're going through a test like this, when we're identifying a vulnerability in a medical device in a hospital, and I know there's no perfect answer at this point, but what are the next steps? We've identified a risk. We're obviously talking to the hospital if we're testing their network, but what are they doing? Are they fixing it, or are they going to the manufacturer at this point?
I think it can be a bit of both. I think a hospital can take some of the concerns or at least some of the issues that have been identified and bring them to a manufacturer and be like, hey, we had our network tested. We noticed some suspicious traffic, or we noticed just some things that are causing some concern. Is that something you're able to implement, or if you're currently going through R&D and just really building more, or do I guess making more changes to your existing device? Is that something you're aware of? Is that something that maybe is getting addressed in the next software update? If not, what can we do as our hospital to add safeguards just for our personal net or our organization's network? And if the manufacturer isn't able to, or is not just choosing to address those issues, the hospital can take steps to at least better safeguard their patients, their data.
I know you mentioned there if the manufacturer won't or can't, and I think that is a really difficult problem to face. It's something that we see all the time where a manufacturer, even within the hospital, of course, or within the device manufacturer who has a component with risks and they need to address these risks, but whoever's providing that component is not willing to help them out. And it's a difficult situation at that point. Do you need to find a new component? Is there anything you can lean on to try to force their hand and help get a fix in place? And it's a little bit of a tricky solution to face, especially when you're using a critical component or a critical device that is going to be disruptive if you remove it out of the system.
Yeah, absolutely.
All right. Now, when we're looking at security, compliance, and safety and how everything gets tied together, I know we've been talking a little bit about what can happen, but what really happens when there is a cybersecurity risk that gets exposed and hopefully not, but taken advantage of by an attacker. We talk about this as our primary concern, and it's something that we've mentioned that cybersecurity is a patient harm problem. And this is something that is really important to have a clear understanding for. This is not just gated to the access of information or data or trying to, ransomware to try to say, oh, we're going to leak all this healthcare information. What about the devices that are no longer operational? What about the patients that need critical care that need to be rerouted to a different hospital? There are many cases where patients have been harmed, patients have had delayed treatment, patients have even died because of cybersecurity attacks in hospitals disrupting the care that they need to be healthy. Of course, we are seeing risks of violation of compliance, that there's data exposure. I know we're saying that patient harm is the primary focus, but this isn't to say that data exposure is going to be something that we can just leave aside. And of course, you're going to see trust erosion. With the devices, with the hospitals, if there is a major attack or a major breach, it's pretty difficult there. All right, I saw that we had a comment come in about SBOMs for embedded C and C++ is a huge challenge, even with big players in the SBOM market like Black Duck or Sneak. Not been able to see them generate an SBOM for embedded C, and they've tried for 5 months. So this is something that is really important, especially when we're building embedded systems, understanding how that works its way back through the supply chain and what we can actually do to control this. So there are a couple of things that can be good to think about when we're looking at C and C++ SBOMs, especially on embedded systems, so that we have this full traceability in the supply chain. Looking at runtime protection and runtime builds, there are some great solutions out there. RunSafe, FOSSA have some very robust SBOM tracking solutions for C and C++ even, but it ultimately isn't a solved science. So the main difference is how we're detecting these libraries. If you have, say, Python, you just have a list of all the components that you're bringing into the system. It's very easy to track. With C and C++, you're analyzing the code and doing effectively a comparison against other code to see if it is an effective match. Now, one big issue where this can come into play is if you are integrating closed source code into your system, you're going to have to explicitly call that out because most of these tools are not going to be able to see closed source code. And as such, they aren't going to be able to do this similarity check. And so that's why they're probably going to miss it. So it's an unfortunate problem to face, but there are a couple of tools that are doing a pretty good job at it. And ultimately, just having a clean register of what you're pulling into the system and making sure that you review that against what you're actually seeing is going to be the most effective way to cover this issue.
I mean, I'll jump in. I might be opening up a can of worms, but I feel like especially as more kind of security-backed AI or machine learning models kind of get introduced to the market and get integrated into some of the security products like Sneak, like FOSSA, we may start to be able to address some of those challenges where existing tools have some of those weaker areas or security gaps, and you can start relying on some of those language models to help identify things that have been previously missed. So I think as kind of worrisome or concerning that AI can be, especially when it's used in the coding process as a whole through vibe coding, it does have some good areas where we can start building a little bit more security by using it to maybe go through like lower level assembly, C, C++ code bases, and start identifying security issues that way as well.
Yeah, and you bring up a great point there with some of the big push towards AI tooling. I know Anthropic recently with their Claude Security has been making some pretty huge waves on handling some of these issues. And so hopefully the tooling will catch up. I think that C and C++ SBOMs will eventually be solved, but I think we're just in the process of getting there.
Yeah, absolutely.
All right. So when we're looking at the shared responsibility model, there are, of course, every case is going to be a little bit different. Some healthcare delivery organizations might be a little more or a little less mature in their capacities, similar to manufacturers. But in general, there are a few easy wins and big ticket items that we can make sure we have covered here. The HDOs have to make sure that they have a clear understanding of what is in their environment. You cannot address risk if you don't know exactly what is in there. And we do this through asset inventories. There are automated tools that can do this. It can be a very manual and a frustrating process for the hospital IT staff. But however we're doing it, we want to make sure we have clear understanding of everything in the network. Similarly, we want to segment the networks based on risk, based on use, and based on who needs to be on that network. There's no reason for us to have a surgical robot connected to the same network as the HR staff at a hospital. There's no reason that we need a pacemaker to ever be able to communicate with, say, an oxygen pump that is in, a different room. So when we're designing these hospital networks and we're properly segmenting things, we should have this broken out by what needs to talk to what and nothing more, and make sure that if an attacker is able to breach a device, they're limited in how far they can go. We want to clearly define who owns and who controls what. This isn't something that we can do on an ad hoc basis. It should be done before we are approving any product for use in the hospital, even as we're just designing this as a framework. At a high level, who is responsible for these processes? Who is going to run these? We need to be sure that we are monitoring any devices for known vulnerabilities. This can be through trusted sources such as CISA or the FDA, or information sharing centers such as HISAC is a great option. And the hospital itself needs to perform regular testing. This is something that goes over to the medical device manufacturers as well, but it's especially vital that we have regular penetration testing, regular network testing, and we make sure that we have full coverage on both ends. In addition to that testing, we want to see that manufacturers are building secure devices. So we've talked about these secure by design principles, some of the early threat modeling, having a clear supply chain inventory. Building this in a ethical and in a quality way is going to allow us to make sure that we have a more secure product. We want to have this transparency throughout this process as well. So as we're getting the supply chain tracking through the SBOM, we need to have clear disclosure of risk through the labeling, as well as covering any best practices. Manufacturers are ultimately going to be responsible for deploying patches into the devices. If there is something that a healthcare delivery organization comes back with as concerns, if there's a vulnerability in the device, the manufacturers are ultimately going to be responsible for fixing that. I just saw that we had a comment coming in asking, can you tell about the new difference in FDA guidelines for what is released in February 2026? This is a very common question that's coming up lately. So the big change that we saw in 2026 relating to cybersecurity is that we're trying to push away from 21 CFR 820 into the new FDA harmonized QMS regulation. So the quality management regulation, or QMSR. What we're trying to do is have a little bit more maturity within the quality system. And so now just adherence to ISO 13485, which was typically seen as good enough or the best practice, is not going to tick all of the boxes. And we're wanting to see some more comprehensive approaches across the industry there. Relating to the cybersecurity activities and testing, if you're asking about what deliverables the FDA is going to want to see, the specific changes in February 2023 did not affect too much on the cybersecurity side. What we do need to be sure is that the deliverables that we prepare as evidence of these cybersecurity activities integrate well into existing quality systems or new quality systems as per QMSR. So that should be the main focus that you should take away, and the main thing that you should be concerned about relating to the latest cybersecurity guidance changes. All right. So I know we've talked about a couple of practical steps here at a high level, going through the threat modeling, having a secure SDLC and penetration testing. One thing that I do want to talk a little bit more about is post-market management plans. So we've gone through all of these different testing types. We've talked about SaaS, we've talked about the SBOM, we've of course talked about penetration testing. This is something that we need to do early on before we're releasing the device, but do we need to keep doing this, Parker? And at what time should we keep doing these activities?
Yeah, no. So post-market management is really important because I think like most industries, and you can really look at like car manufacturing is a big one. You get a car off of a dealership, and a few months down the road, there's a manufacturer recall of maybe a defective airbag. And you hope and you rely on the car manufacturer to know if your make and model is like vulnerable or susceptible to that manufacturer, if you're being impacted by that issue. And kind of the same happens with security and with security in other devices. And so you hope that the medical device manufacturer knows what components are in their device and if you're going to be affected by that. And they need to have that kind of strategy for if that does occur, how do they either recall the device and fix it in-house, or can they deploy maybe a software update online, or have a technician come in and manually update the device? And I think it's important for manufacturers to have a good strategy for if that does happen after a device has hit the market, and being able to kind of consciously know how to manage the security and the operations of their device after it leaves their facility.
Completely agree. We want to see that this is an ongoing effort. You shouldn't just assume that a device is going to be secure forever if it's temporarily secure once. As time goes on and as things change, the risk profile will change as well. So generally we see if you're making a major change that would trigger new testing, or annually is a good time to check in and make sure how everything is looking on that end. All of these different testing activities are going to go through varying timelines. So static testing as you're changing the code, SBOM monitoring should be a near constant process. We shouldn't have any gaps in that, since there can be so much research and the threat profile can change overnight. And so having a good understanding and really being on top of what the risk is in your device is vital to make sure that it is going to be secure throughout the life cycle of the product. All right, talking about what some providers can do. So one thing that I really want to look at here is when we're talking about risk acceptance criteria. And this is something that we haven't covered yet as, a critical step for providers to take. Risk acceptance criteria is effectively going to say, what are we okay with and what are we not okay with in this network, in this device? And so even as something that device manufacturers can take on as a strong effort. When we're looking at risk acceptance criteria, a general blanket statement is that we shouldn't be tolerant of something that can expose patients to harm. Though in healthcare networks, obviously, there are many different types of risks that may be present. And so what is a good threshold for us to talk about? What should be some of these critical risks that manufacturers need to be or that healthcare providers need to be really concerned about in a hospital network, would you say?
Yeah, so I think it's really important. Yeah, you're framing everything in kind of the lens of patient harm. So there's a difference between, if this device is compromised or malfunction and delivers a small shock every 2 months, versus if a device gets compromised and releases a life-threatening discharge of electricity, every time it turns on. So you really need to be able to identify what is, likelihood of this happening, how impactful is it to the patient, and kind of start looking at what kind of risks can be accepted, just as in the lens of, I guess, a patient.
100%. All right, let's go over some of the main things that I want to talk about as some takeaways. And, of course, if there's anything else, we can jump in there as well. The first thing is that connectivity is not going to be optional anymore, and risks can be severe. The genie's out of the bottle at this point. We aren't going to go back to a time where medical devices are no longer connected, are no longer in deployed connected healthcare environments. And so we need to say that this risk is going to be present in the system. The risks exposed through a network device are going to be present in the system now. We need to address these, and we can't just try to hide from it. Cybersecurity is a patient harm problem. In the medical context, this is our number one focus. This isn't to say some of these other areas are not helpful, but it is extremely important that we're covering this. Governance is going to matter just as much as some of these controls. So who controls what? Who is responsible and taking on ownership for these processes? It's vital to have this clearly defined and clearly understood and executed on. Now, the one thing that I really want to lean into here is transparency and collaboration. This needs to come from both sides. Manufacturers need to be very open and transparent about what is happening with their device, what healthcare delivery organizations can do to boost their security posture. And similarly, the HDOs need to work with manufacturers to allow their systems to easily integrate with these devices, to be, forthcoming and helpful with providing any information about what they're seeing. I'll go back to that example, what we were talking about earlier, when a penetration test is going on in a hospital network and you see a risk in a medical device. What are some of these next steps? It's probably going to be really important information for maybe the manufacturer to see that pen test report, even though these are generally going to be some private and very private information. So talking about what we can do on both sides of the fence to make sure that we're collaborating here is going to allow us to have more effective control over medical devices and make sure that we're fully addressing security here. All right. I also saw a comment come in here. What are some additions to the security architecture report according to the FDA pre-market submission guidance from 2026? So when we're looking at the security architecture and zooming out a little bit, exactly what this is a deliverable that the FDA requires from medical device manufacturers describing the architecture of the device through a few different lenses. And so they call these security architecture views. We have the global system view, and so there are 4 that are required. The global system view, this should cover the end-to-end device, all components, any update infrastructure, everything involved with the system. It is the global view of it. Any communication flows, any handoff sequences within the device, what is going on, a description of all of these components needs to be captured there. We're going to have the multi-patient harm view, which should describe different criteria, different situations, or different components that may expose multiple users to risk with a single instance of compromise. This can be through compromising one instance of a device that compromises multiple instances of the same device, or through compromising one device that is going to compromise other devices in a connected environment. We're going to want to see the updatability and patchability view, which is how the device is going to receive updates in a secure fashion. And then finally, we're going to want to see the security use case views. These are going to be really flexible and vary depending on your device. We need to have an understanding of every functionality and every state in the product for each functionality and state. So think about power on, power off, standby, active therapy, these different states. How are we addressing security through these functionalities? And so those are going to be the 4 main lenses that you need to cover with your security architecture view. All right. This is a good time where I can turn it over, Parker. See if you had anything additional that stuck out as a main good point, something that we can take as a manufacturer or as an HDO to try to boost our security posture with some of these easy wins here.
Yeah, so I think it kind of goes back to, for me, SBOMs are really important. Knowing what components are in a device that's coming, either something you're building or coming into your network. So SBOMs are really crucial when it comes to overall support in the lifetime of a device. Network segmentation as an HDO can also be really critical, keeping your devices separate from key or critical infrastructure that they have really no need to be reaching out to or being able to connect to. Another easy win. And then that open kind of transparent communication between HDOs and manufacturers. If a hospital staff or a CISO identifies something, being able to communicate that back to the manufacturer, then be receptive and excited, I guess maybe not excited, but open to whatever information they can get from a provider, being able to take that seriously, digest it, and maybe implement some changes or communicate what they're doing or what steps are being taken back to the HDO. Just having that open line of communication is really key and critical.
I love it. Yep. Transparency and collaboration before anything else. All right. Well, I'll go ahead and pause here. We'll see if any other questions come in. I'm glad that we were able to talk about this. These are some really, really important things. And this is something that comes up all the time. And so I'm happy that we were able to go over some of this. I don't think that it's a solved science, but I do think that we're getting a little bit closer to a shared maturity model where hopefully eventually hospitals, manufacturers, kind of everyone involved is going to work a little bit more closely on some of these things. So, and I know that it's always going to be an ongoing effort, but I think that recently we've even seen a little bit more of this tight shift where some of the manufacturers are taking this a bit more seriously and trying to cover some of these points earlier. Don't you think, Parker?
Yeah, absolutely. I see that trend kind of across all of the organizations and companies we get to work with. They're definitely really taking, the new regulatory requirements and the new, even international standards that are being developed, really taking those, implementing them, and we're seeing big changes across the industry.
100%. And if you have any questions on anything that we've talked about, if you want to lean a little bit more into any one point that we've covered, or if you need help with anything that we've gone over, looking at some of these pre-market, post-market cybersecurity activities from both sides of the fence, as the HDO or as the medical device manufacturer, we have some information up here, and we'd be happy to have a conversation a little bit more about that.
Yeah, absolutely. We've got a great team standing by and always happy to help.
All right. Well, we'll give it another couple of minutes here, see if any questions come in, and then we can go from there. I don't know if this is maybe just a Northern California thing, but do you guys get too much fog up in Oregon?
Not usually. We've had a few days over maybe the last kind of, I guess, this like winter season, where you get up kind of early in the morning and the fog can be pretty thick. But I think just with how we're like settled, closer to the water, closer to the ocean, and some of the mountains that are nearby kind of help keep that out, which isn't too bad.
That makes sense. Yeah, I was just looking out the window here, and this morning it was nice and bright and sunny, and then I slowly see the fog wall rolling in here, and so it's starting to get a little bit more murky out there. I did see we have one question come in here. What is the role of QMSR in the labeling report? So the labeling report is going to be a disclosure of potential risks and best practices for use of the device. The SBOM can also be part of this labeling. When we're looking at that labeling as what the FDA wants to see, so cybersecurity specifically, there's a lot that can go into labeling outside of cybersecurity that I'm not going to touch up on too much, but we need to effectively describe what the device is so that a hospital IT admin or whoever is going to be deploying this device can safely and securely integrate it into an existing network. I'll give you an example, and this is a very common one. If we have a device that is processing DICOM images, it's a very old image format. And so by default, these are going to be unencrypted. Now, it is also a best practice to have optional encryption for DICOM images. However, the hospital delivery organization or the healthcare delivery organization might not have a configuration or a setup where they can accept the encryption there. So what we would recommend is that in that labeling, we are saying, hey, it's a best practice to encrypt this information, but it's not something that is enforced on the device in case it's impossible. So at least they have an understanding of the risk and they understand what efforts they can take to cover that themselves.
Perfect. And then I know we've got another one. Maybe it might help a bit, Trevor, if you could explain what like the QMSR really, like maybe some background or what benefits that can provide.
Sure. So the QMSR is meant to replace 21 CFR 820 and is trying to build upon principles through ISO 13485. It is the quality management system regulation laid out by the FDA. And so this branch is well outside of any cybersecurity activities, but it is effectively going to be a regulation, a framework, a guidance document for us to implement more effective quality procedures and bridge some of the gaps that might not be fully covered by ISO 13485. I won't speak too much on some of the variances outside of cybersecurity since that can get very involved very quickly. But in general, it is trying to make sure that we have a little bit tighter control over processes and documents across the board. All right. Well, I think that's about everything that we have coming in here. I do want to say thank you all so much for taking the time to jump in on this webinar. And we're looking forward to the next one. We'll go ahead and send out an announcement shortly here about what we're doing for the next month, and we're excited to see you there.
Definitely excited to have everybody here and excited to be able to be a part of this one as well. Hopefully I'll make an appearance one of the next webinars we've got.
Definitely. All right. Have a good rest of your day.